what I'm going to do is talk about residues from the FSIS perspective. I'll try not to step on the toes of my colleagues here at the podium, but we'll probably overlap a little bit because a lot of what we do is overlapping. Perhaps that's a good thing or not in the government, but that tends to be the way things are. We are the food safety agency within the Department of Agriculture. Sometimes that's a bit of a challenging place to be, as Dr. Raymond alluded yesterday. And I will say that while for the past almost 20 years we've been 90% focused on pathogens, as I think everyone understands and realizes is the case, we have been monitoring meat and poultry products for several decades, actually back to 1967 for residues. So this is actually probably the oldest scientific public health activity within FSIS and predates our concern with pathogens. So here's the outline of what I hope to cover today in order. I'm going to start with the focus on our National Residue Program, which is kind of the cornerstone of our efforts to monitor, especially for the use and, importantly, the misuse of drugs in food animals that we regulate. I will talk about a specific problem that's arisen, a concern, I'll say, in the last couple of years with that second bullet there, and talk about how we are attempting to address some what I'll call unevenness in the level of testing across the various species classes. Then I'll talk briefly about NARMS and the FSIS participation in NARMS, and you'll probably hear more about NARMS from the principal sponsor of NARMS, the FDA, and Dr. Lewis here. I'll briefly mention, and actually throughout the presentation, talk about methods and method changes, and I'll end up talking about something that really doesn't have anything to do with drugs, but just illustrates our efforts to continue to pay attention to the potential exposures that come through food animals and the foods from them, with that last bullet there. So let me talk about the National Residue Program, which, as I mentioned, started in 1967, has evolved some, maybe not as much as you might imagine, given the number of years we've been operating it. It is a process for identifying the appropriate use of not only antibiotics but other food animal drugs as well as pesticides, and you can see the list of other things we're concerned about. There's a little bit of the program that's focused on environmental contaminants. So I'll just mention here briefly, we do monitor for cadmium, lead, and arsenic as environmental contaminants. And I'll come back to that at the very end when I talk about chemicals without tolerances. But it's important to note that our role in monitoring for residues, as I said, is in conjunction with other agencies. And principally, it's the EPA for pesticides and the FDA for food animal drugs, veterinary drugs. So while we regulate the foods that are produced and are obligated to make sure that they are safe, we are actually acting as monitors for these other two agencies for the appropriate use of both pesticides and veterinary drugs, respectively. So we work very closely with FDA. I'll make several references to FDA throughout so that you understand that there is that relationship. And again, you'll hear more about that, I'm sure, from Dr. Lewis. So the National Residue Program is, in essence, co-managed. We host it at FSIS, but it's co-managed, especially with FDA and EPA. And there are some other agencies that we include in our periodic meetings and in our annual meeting to plan each year's program. So there are two major components to the National Residue Program, and this part really hasn't changed very much over the years. There is what's called the scheduled sampling. This is the monitoring program. This is random sampling across the various product classes and consists of samples from animals that have passed antemortem inspection. This is a fairly low-level program, and frankly, we get very few positives or even any violations, or very few violations from this part of the program, but it is our effort to sort of scan the entire food animal population and the foods that are derived from them to ensure that they are safe. The second part of the program is what we call our inspector-generated sampling program. This is consists of the work of the in-plant personnel, and I didn't mention this, but I think everyone realizes we have inspectors in the plants every day that they operate, and for the slaughter plants, they're there the entire time the plants are operating or slaughtering animals. So we have a significant presence of in-plant personnel, and for most of the big slaughter operations, there are public health veterinarians there who are asked to make judgments in their evaluation, both antemortem and postmortem, to determine whether an animal or the organs or tissues of an animal should be sampled for the potential that it may contain violative residues. So this is a significant part of the program, and I'll come back to this. But basically, they are looking for conditions which would warrant their concern because of the possibility of drug use. So things like mastitis, metritis, septicemia, the presence of injection sites would raise their concerns as well. I will also mention here that the outline of the program, and it does change a little bit from year to year, is found in what we call our Blue Book, which is published on our website. The 2013 Blue Book, which is the sampling plan for the year, is found on our website and is readily available to all of you. I want to spend just a few minutes on a few simple flow diagrams to talk about these programs. As I mentioned, the implant personnel will identify a carcass that ought to be tested for residues based on any number of concerns. They record all the information that's available about that animal. That little blue box down there talks about anything that's recorded on a tag or in the paperwork that accompanies animals to the plant are recorded. Then there's an in-plant screening test that's done, and right now we're using something called a KISS test. It's a kidney inhibition swab test, and it actually, as the name implies, tests kidneys for the possible presence of veterinary drugs, and in particular antimicrobials. Based on the result of that in-plant test, if it's positive, the animals or the carcasses and any tissues that are derived from that carcass will be held. The sample will be sent to the FSIS laboratory, and then the further testing and confirmation will be done. If the in-plant screen is negative, the carcass is released for human food. I will say here that this inspector-generated sampling that's done results in about 200 to 225,000 tests per year across the entire food animal spectrum, so it's a significant amount of work done at the in-plant level. Now back to the what's called the surveillance testing. This is the testing I mentioned that is random. It's across the entire group of food animals and the foods derived from them. You can see there's a branch here because it denotes the change that was made in August of 2012. If you follow the lower branch first, we had a scheme where we were using in-plant screening test. Used to be called FAST, now the KISS test for the last several years. If we got a positive, again, the sample would be sent to the lab. And since we've been using the KISS test, the lab actually repeated that test in the lab, and if that was positive, then there were these several different assays that were done in the lab, primarily in the Midwest lab. And I won't go into any detail at all, but the 7-plate bioassay is about a 30-year-old method that we are finally leaving behind, with a few exceptions. It was a very imprecise test. It was based on unidentified or unidentifiable, in some cases, inhibition, which might denote the use of an antimicrobial, but might also denote use of another drug that we weren't able to identify. It relied on zones of inhibition that were very imprecise and had to be estimated to determine the level of inhibition and the possibility of the level of drugs that might have resulted in that test or test result. As I said, we've left that behind. Over the last couple of years, we were collaborating with ARS who helped us develop an LC-MS method, and that's where the upper branch there suggests the use of these what we call multi-residue methods. We're now able to test for 58 different residues in that multi-residue method. There are 9 different aminoglycosides that are tested in a separate test, and there are 50-plus pesticides, which are not depicted here on this. So we're able to do, in essence, over 100 analyses per sample. I'll come back to that in a minute, which has really increased our efficiency. Here, once the sample hits the lab, just briefly is the flow diagram within the lab system. And you can see, as you can imagine, the negatives are reported back to the plant, and that those carcasses are released if they've been held. And for almost all inspector-generated samples, we expect the carcasses to be held. For any positive, we go on to determine the exact drug present and quantify the level of that drug, and then those carcasses or parts are condemned. And sometimes we get, at the bottom, you'll see positive non-violative levels. We've now changed the terminology to detected non-violative. And here we just report that we found a compound. It is not a violative level, which means that it was used appropriately, whether it's a pesticide or most commonly a veterinary drug. So we report that as a matter of information, and you'll find that in what we call our red book, which is the report of the findings that we publish on an annual basis. This covers some of the changes to the National Residue Program that I just outlined for you. The bottom bullet I'll spend a minute on here. Instead of testing one sample for one compound, which was our historical way of testing for residues, we are now able to test more animals in a given species class for these multiple analytes. As I mentioned, over 100 analytes per sample, and this has greatly increased our ability to, in essence, scan the production class for the presence of any residues that might be of human health concern. I'll also mention here that part of the change in this has resulted in the fact that we now are changing the ways that we are able to detect certain residues. And something came up in the past couple of years that I'll just mention here, and that is our ability to detect penicillin G in sows. Previously, a positive in-plant screen would result in a 7-plate bioassay determination of the residue, and we were unable to detect penicillin in that 7-plate bioassay. When we moved to this new screening method, we were finally able to detect penicillin G specifically with this multi-residue method, this LC-MS technology. And so suddenly we were able to find penicillin G and confirm it in sows where it has a zero tolerance, whereas in the past it was an indeterminate finding and we were never able to identify it. So I just give you that example here. I've already covered this. Obviously, it makes sense to us, and it's much more efficient for our laboratory systems to be able to detect these multiple compounds in a single sample. And you can see the little depiction here of that. Also described in that summer of 2012 publication is what we call our 3-tiered model, and I'll just spend a minute here telling you that the scheduled sampling that I described earlier, this random sampling across production classes, is what we call our Tier 1 sampling. Any repeated findings in Tier 1 sampling may suggest a need to do more targeted sampling, and you see the reference there to Tier 2 testing. Tier 2 testing consists of this in-plant testing that I mentioned earlier, the 200,000 plus tests that are taken by public health veterinarians based on a suspicion of drug use. The Tier 3 has not yet been implemented. That caused quite a few questions and even some concerns when we issued that Federal Register notice in 2012. The concern being that we would make determinations about flocks or herds based on findings in a small number or even a single animal. We've not gone to that level. We've not done any Tier 3 testing just yet. But the concern is, and I think everyone will understand this, is if you find a positive violation of a vet drug in a broiler or in a market hog, you would assume that all those animals and birds are raised in the same sort of environment and exposed to the same drugs. And so the concern is, how do we interpret a positive finding from a single sample, from a single animal or bird? And that's where our Tier 3 thinking is laid out. We have not yet made any determinations, and we've not implemented that at all. I will mention here that I told you earlier we have the Red Book, which is the annual report of residue findings. That takes 6 to 9 months after the completion of the testing year, whether it's and it used to be calendar year. We've just moved to a fiscal year. We have heard a lot from the industry that they'd like more timely data reporting, so we have just published our very first quarterly report. It covers the quarter 3 of the fiscal year 13, which is the months April through June. It's available on our website, and as I said, was just released within the last few weeks. It's simply a data report. There are a lot of tables there. It talks about the animals that are tested, the number of tests that are done, the number of findings, and the number of violations. And it is not intended to replace our annual report, which has a lot more interpretation of the findings in it. It's simply a data report, and we hope that the industry will find that useful. I want to talk, just show you an example of the 2012 data. And when I mentioned earlier the Red Book or report of annual data is not timely, this is still labeled preliminary. We hope to get this published in the next couple of months. But I'll show you here the difference in the domestic scheduled samples and the inspector-generated samples. I just mentioned there are many more inspector-generated samples. But you will notice that whereas there are quite a few more violations in inspector-generated samples, as would be expected, the overall rate of violations is not significantly greater. So just to point out, also in the last column, you can see the kinds of violations that we found and the list of the drugs and the numbers of violations of the various drugs. Let me move now to this issue I mentioned at the beginning of what we term unevenness in the level of inspector-generated tests in the plants. So the best example perhaps is in market hogs, which are raised in the same environment and exposed to the same things. And we have, and I'll show you a table in just a minute that shows significant differences in the level of in-plant testing across a few of the plants. And we're trying to understand better this variability in testing. We have some concerns that there may be two possibilities. One is that there's a directive, which is instruction to our personnel, that lays out the conditions that public health veterinarians should be concerned about when they decide whether or not to take a test. And it says, and probably appropriately says, it's left to professional judgment. But when you see the table in a minute that shows you 3 different plants and the testing rates for market hogs, it causes you to wonder about the thinking that goes into the decision whether or not to test. So we're trying to understand that better, and I'll tell you a little bit about how we're trying to tackle that. So we had a work group look at the level of in-plant testing, as I just mentioned, to examine the variability in the testing across production classes. One of the things we wonder is whether there should be some floor level of testing, some minimal level of testing in all production classes. Again, we have not made decisions about that, but it's something we are considering. Now, this is a table that shows you the preliminary calendar year 2012 in-plant testing. I'm not going to spend a lot of time, but I do want to point out a few things on this table. First of all, if you go to the far right column first, you'll find that we have pretty good coverage. That is, when you talk about in-plant testing, of the vast majority of the volume of production. What you'll notice, though, in the middle column, which has, it looks like purple figures, that we are not testing the majority of the plants, because what we're missing are some of the very small slaughter facilities. But if you go to the far right in terms of human health risk, we are testing a large volume of production across almost all of the slaughter classes. So I did want to point out that we do get that coverage, although we don't test all of the plants. We're not doing testing in all of the plants. Okay, here is the table I wanted to show you. There are 3 different districts depicted. You know, we have 10 districts now in FSIS, and you can see for Q1 of 2013 the comparison of, this is market hogs, the number slaughtered. And if you just look at District A and District B, similar numbers of hogs slaughtered in those 2 districts. The number of suspect or condemned animals is slightly greater in District B. But if you look at the in-plant KISS test, that is the inspector-generated test for suspect animals, you'll see that in District A, which had quite a number of suspect and condemned animals, there were 0 in-plant KISS tests done. In District B, there were 389. If you look at District C, which had more animals slaughtered, and slightly fewer suspects and condemns, still had a significant number of in-plant KISS tests. So this is the variability I mentioned earlier that we're trying better to understand in some of the work we're doing now. So one of the things we're doing to try to get at this is we've launched a pilot, and this is being done now in the Des Moines district. It's actually in its second phase, and I'll explain that. The first phase was simply a survey of our in-plant personnel to try to understand whether or not they were able to take residue samples, if there were barriers to taking those samples, to let us know what they were, whether or not the plants that they worked in had residue control programs. And some of you may remember, be familiar with the 1999 survey. This current survey is an attempt to repeat some of the questions. So it asked about the number of plants that had residue control programs, how many did residue testing, and the number of testing plans that were implemented at the livestock production level, and then the number or percentage of plants that did not address residues in their HACCP plans. Again, we're trying to determine whether we need some policy change, that is, this floor level of testing, or whether there may be a training need in terms of the public health veterinarian training, or this is just an expected variability that we're finding. And so we're trying to understand this. So there's been this pilot done. The second phase is underway now, and it in essence is a correlation. We have surveyors go in to the plants and observe the practices of our in-plant personnel when it comes to residue testing. Let me just talk a little bit about NARMS, and before I get to this slide, just let me say that we've been participating in NARMS at FSIS since its beginning, and our participation up until recently consisted of taking HACCP verification salmonella samples and sending those isolates to ARS and then to FDA, where they be evaluated and included in the NARMS samples. FDA has received some feedback over the years that the samples that were contributed by FSIS were, there were 2 problems with them. One is that they were a bit redundant with the retail meat sampling that was done in FDA, and secondly that these were non-random samples. And so they wanted to, FDA wanted to make some changes and ask us to consider sequel sampling, which has been underway now for almost a year. And what we do is we take sequel contents from the 4 major classes of animals, and for turkeys and chickens, I'll say we composite samples. We take 5 SECA from turkeys and chickens and composite those, and we send those to FDA now. We isolate the organisms and send those off to FDA for inclusion in the NARMS program. at the very bottom, and it's a little bit faint to see, but the question is, are these more representative of live animals and on-farm samples? So there's an effort underway now, and I won't go into a lot of detail here, but ARS has sponsored some on-farm studies the past couple of years. They continue now to try to determine whether there's a correlation between the findings in live animals on the farm and the cecal samples. Because, again, the effort here was to determine if the cecal sampling would be more representative of live animals, and that would be a better contribution to the NARMS program. So the jury's still out on this particular question. I'm not going to spend any time here, but just to show you, this is the number of samples we've collected to date since March of 2013. The number of positives for Salmonella campi, E. coli, generic E. coli, and Enterococcus. And I don't think any of these numbers will be surprising to anyone. I will say that we have a little bit of data back from FDA based on the early samples that we submitted to them, and we've identified, between March and May, we've identified only 3 samples that were multi-drug resistant, 1 in chicken and 2 in turkey. So the early returns are that we're finding very little, despite the number of positive samples, we're finding very little by way of multi-drug resistance in these cecal samples. One of the things that has allowed us to do this work is that we have begun to insource a lot of the lab work that we historically had sent to ARS, as well as to APHIS. In fact, we sent APHIS all of our salmonella isolates in the past to do the serotyping. We're now doing molecular serotyping in-house in FSIS. We've begun this past year to transition to do pulse field gel electrophoresis and antimicrobial susceptibility within our labs, and now we're able to do all of that work with a very few exceptions in the FSIS system. We're still working out with FDA whether we will isolate the organisms and do our own antimicrobial resistance, or whether they would like for us to send them the isolates that end up in the NARMS program. So we're engaged in those discussions right now with FDA. I want to spend just a minute here on what we call our multi-hazard project. Again, this is not squarely related to veterinary drugs in particular, however, is indicative of our effort to expand the way we look at food products that we regulate. We have undertaken an exploratory program to look at the presence of various hazards in a single sample. And in this case, what we're doing is we're taking pathogen samples and sending them to our chemistry labs within FSIS to determine whether they also include chemical hazards. We're looking not only for the hazards that I mentioned earlier in our multi-residue methods, but also we're looking at chemical unknowns and determining whether or not there are some chemicals present that we don't identify currently and with our current methods. And then we'll make a determination eventually about the total risk from a particular product. That's the goal, is to identify and characterize the risk from a single sample, both on the pathogen side as well as on the chemical side. So that's a project that's just underway recently. Here's just a placeholder for you. I think everyone's aware that our chemistry methods are on our website, readily available to everyone, and they do get updated fairly frequently. So I encourage you to go if you're interested in our methods. They're all the validated methods on our website. And this is just a summary table. I won't spend time here. It summarizes the various methods that we have and in which species class we are able to use those methods. And you can see also the designation that there are some for which we test the muscle, others we test the kidney and the liver. Depends on the target organ identified to us by the FDA as to which samples we test. But our goal is to test muscle, since that is the primary edible tissue from food animals, in addition to whatever the target tissue is identified by the FDA. I will also just draw your attention to that last column. We have validated all of our chemistry methods for equines in the event that there will be slaughter of horses, which remains in the hands of the courts at the moment. But we have decided to go ahead and validate all the methods currently available for other livestock for equines. And I'm going to end here, as I mentioned, just talking a little bit about chemicals without tolerances. What I mean here is, I think everyone remembers the melamine incident from a few years ago. That was an instance in which there had not been a tolerance developed for a chemical hazard that presented a lot of both scientific, public health, and political issues for the U.S. And in short order, we worked with the FDA to develop, actually the FDA developed initially the tolerance for, I believe it was formula, and then FSIS adapted the tolerance for food animals, and then we made some determinations. So we anticipate we'll have other instances in which we have a chemical that suddenly comes to our attention that we need to develop a tolerance for. So in essence, this effort is an attempt to develop a framework for determining tolerances. And I won't go into detail here, but here is outlined our method to do this. One is to look at any kind of a public health reference level, whether it's a reference dose or a tolerance that may exist even in another country. Use that as a starting place to collect monitoring data based on that chemical, and then to determine whether we need to set up a regulatory testing program for that, and how we would make some determination that there is a risk to human health based on our findings. The first candidate for this process that I've just described is cadmium. This is a heavy metal that we've been asked to monitor by the FDA for some number of years, and of course is a carcinogenic. Its contribution from foods are questionable, I would say. There are other environmental exposures and other exposures that probably drive the risk for human health consequences, but we're going to use cadmium as the example for filling out this framework that I've described here.